So when we get to the lower extremities, which is our next section here, the first few pictures are kind of like good to print out because they show us all the things we go through. We have a few of these slides that are just sort of nice to print out in big, or at least 2 per slide. But we're gonna take these muscles again and look at what do they do functionally. So when we look at the hip, the first stuff we're looking at is we're looking at pelvic muscles here. We gotta turn that foot out. And so that's when we turn the foot out, we actually move our hip outward this way. So we move it to this side. We move that motion is done up in the hip. And so when you say here lateral rotator group, there's a whole bunch of muscles that basically attach all in here more or less and move out to the hip and pull on it so we can turn the foot out. Does that make sense?
Yes.
So that's what they do. We basically here take the piriformis as the one muscle that we want to sort of talk about it because the other ones are really small. You can see them down here. You see Gluteus Medius, you see the piriformis, but then you see gemellus superior, obturator, and then another gemellus here, and then a quadratus. So those are a whole bunch of them. They just give them all different names. They're all attached sort of more here, more or less, and reach into the hip bone. So we pull that over. So we're looking at the attachment. The piriformis actually is attaching to the front of the sacrum, the anterior border on the side, anterior lateral border on the sacrum, and it goes into the greater trochanter of the femur. That's the big bump on the side of your femur on your thigh. That when you bang into it, it kind of hurts. That's the greater trochanter. What does it do? It laterally rotates the thigh, and it also assists in abduction a little bit. So when he pulls here a little bit, the thigh goes out a little bit like that too. So it rotates it backwards, and it brings it to the side. So if you pull your foot to the side, that's also happening with this muscle.
What about when you raise your leg upward?
Well, yeah, but upward to the side, not to the front.
And not to the back.
And not to the back. Front would be flexion, the back is extension, and the side is abduction, which is this thing, abduction. Okay. It's not the most important one for abduction, but it helps the abduction. That's why it says assisting. Mm-hmm. And then the other thing that's very cool about this muscle, particularly the piriformis actually, not so much these, but if you look at the attachment, it's attached in the sacrum here in the front and then to the thigh. And so the sacrum is the bottommost part of the spine that goes upward. So if you look here, the spine goes up. You see that? And as that muscle is attached right in here, if the spine turns to the one side, it can be motioning from down here.
Yep.
So these muscles help stabilize the spine's side bending. Does that make sense?
Sort of.
So it's a little hard to visualize. It's kind of like you take a broom and you stick it upside down and you hold it at the top part and you have to balance it. It's like the top of the broom is the head.
Okay.
And the spine is the broom piece, the wooden part. And the bottom is the sacrum. And so part of what that piriformis has to do, it has to sort of balance the spine up there, that it doesn't fall to one side too much. Does that make sense, Mo?
Yep, that's a good visual.
It's very interesting because you often have people that get these muscles really overworked and they get pain because the sciatic nerve is a nerve that goes behind here in the back down and feeds the back of the leg. You see this yellow thing here? That's the sciatic nerve. And a lot of times when people get pain down into the foot, in the back of the thigh and the calf, they actually have that nerve squeezed. And so that nerve can be squeezed when the piriformis squeezes too hard. And so that can mimic that pain. So it could be that the piriformis is too tight. Mm-hmm. So a lot of people have that. Plus, if you got a tight butt, it's going to be in here. I mean, if your parent were too happy about body training you and you couldn't be having diapers and you had to always squeeze it all in, it's going to be tight back here. There is actually an article I read about that an anatomist is talking about the psychological component of these muscles back here. It's very interesting. Anyway, so that brings us to the next muscle group area, and that's hip abduction. So that's now that motion that we just talked about when you bring the thigh out to the side. And so guess who's going to do that? Muscle in the front? Maybe not. That will pull him to the front. It's probably most likely, ideally, is muscle on the side that's going to pull that thing out. Right? Makes sense? And so we're going to get the muscles that are attached here on the side, more or less, a little bit to the back and a little bit to the front, and they come down and reach down. So there's a few muscles. There is, first we have the Gluteus Medius and Minimus. So the gluteus muscles, the gluteus muscles are the butt muscles. You have three ones. You have, well, 3 or 4. Some people have a Minimus too. But you have a Maximus, a Medius, and a Minimus. And then so many people have even a smaller one. The Medius and the Minimus are sort of like overlaying themselves. So one is right here. From here, it's cut. And it goes down to here. And then the other one is right underneath it, from here down to here. So they do very similar stuff, those two. So they help each other. So when we can kind of group them together, even though they are pretty distinct. So they start at the external iliac fossa, which is the outside part of the ilium. And then the medius is close to the crest, and the minimus is more inferior. That makes sense, right?
Yep.
The crest is right here, and it goes further down here. And then they both go into the greater trochanter of the femur. And they both do basically hip abduction. However, it's never that simple. And again, by the way, if you have pain down in here, you're looking for these trigger points where the X's are, and you find one that tweaks you, you go like, oh, that hurts really good. You take a tennis ball, and you figure out how to squeeze the blood out of that thing, and then these pain syndromes can mitigate. They can decrease. Wow. Yeah, that's why I put that up. The red stuff is the pains areas, and then the dot, the X's, if you actually go into these little X's, they are the places in the muscle where the fiber is weird that causes this pain. So that's what that does. And so if you're a massage therapist, that can be helpful. But the other thing I was going to point out is this. When you walk, you swing one leg, right? So one leg swings. The leg that swings is not on the ground. So that means that up here, there's no support from underneath coming and pushing up on this hip. Right? When that's swinging in the air. How come your hip's not this way and just falls down?
Because it's leveled. It's
leveled. Why is it leveled? Because the muscles on the other side contract and pull it up. And so, guess who that does? That is your gluteus minimus and your gluteus medius. So the ones on this side over here, so the hip doesn't fall down, they have to contract to stay level.
Yeah.
So if you see somebody waddling, it could be they just want to show you their butt. But it also could be that their gluteus medius and their gluteus minimus are not doing so good.
Yeah.
Could be. So that's the story of those two puppies. I know. And then we got 2 more that I want to talk about. But look at this picture first. So, let's talk about them first. So the gluteus medius and minimus have a big brother that lays on top, and that's right here. That's the big butt muscle.
Oh, wow.
Actually, I could show you here again. See this one, this big one? That's the gluteus maximus. Now, this one here looks like it's got a flat butt syndrome. This one here looks a little bit more puffy or bulky. But if you train this thing real well, you're going to be able to train your Brazilian butt. That's the Brazilian butt. So as you do squats, that's what that trains. See, when you look again here, this is where it is, that red one here. This is the hip that goes to the side. So the gluteus maximus, the trigger points of the gluteus maximus are right here. So if anything hurts where it's red, you could squeeze those points and see if that helps.
Yeah.
So we're looking at the attachment. This one is attached. It starts at the sacrum, lateral sacrum, which is right here. And then it feeds a little bit in the back into the PSIS on the ilium. Let me show you here real quick. This is a good one to print out. See here, that's the PSIS right here. That's the back part of the ilium. So the gluteus maximus goes right here, and then it goes up to here. And actually this down here, this fiber as well. See that fiber?
Oh,
then that goes right into here. So the interesting thing is when we look
right
at
into the femur?
Yeah, but it has a couple. When we look at the attachment, it goes the superior linea aspera I wrote down there. Let's go back to the bottom picture. The linea aspera is this line back here in the back of the femur. So the top portion of it is the gluteus maximus insertion. But The other insertion is the IT band. That's the iliotibial tract. Iliotibial tract. And that's this white band that feeds into on the side of the thigh. See that? And the thing is, when you see this muscle, see how here it attaches here, and then these fibers, they go also into here. This is not the best picture because they cross over a little bit more than that. But what's very interesting, you see it here better. You see here how they feed into the outside band.
Yeah.
That's a better picture for that. But what's interesting is you need this band as a strong cable for muscle up here to be pulling on it so the knee goes laterally.
Okay.
Does that make sense?
Mm-hmm.
So it's actually really interesting because the biomechanical advantage is really not there because you're going straight down. Your muscle starts up here, goes straight down. And so you need a really strong exerting force that you actually pull that knee outward.
Yeah.
You have a little bit up here from the Gluteus Medius and Minimus on the greater trochanter that helps. The way it pulls it, that's kind of like the supraspinatus in the shoulder. When you take the arm out, right? The first little degrees, it does that. And then this part can pull in more. And that's like the deltoid muscles. So these are kind of like the synonym of a deltoid muscle. So the last one of those is the tensor fasciae latae, the TFL, right here. And see this here, this front muscle? That's that muscle. So that starts at the ASIS. That's the frontmost part of the ilium. And it feeds into the IT band in the front. Mm-hmm. And you see the pain pattern here is basically the IT band. And the X is right here. And actually, I just worked, this is one of the muscles I worked today. And so when we look at that, we look again, what does it do? Hip abduction. The iliotibial band, which then anchors into the lateral tibia and fibula. That's down in here. Mm-hmm. And when we look at the gluteus maximus, the other thing the gluteus maximus really does well is hip extension. Mm. So if you walk stairs, or run stairs, or do squats, or jump off at the end tail of like jumping up, that's, you know, you can train, you can get a good Brazilian butt that way, if you want. I'm just saying. This is a nice one. This is a foam roller. See this foam roller here? It's black roller.
Yep. That
you can roll out these muscles that way.
And you can rub the trigger points, right?
Yeah, you can rub the trigger points with these rollers. Exactly, and that's really helpful. Or you can stretch it. This is a pretty good stretch. There's a better one that I like to do that's face down. Oops, hold on real quick. Well, that was somebody on the door, huh? Where were we? Oh, we were with this one. So I do the exercise that I actually go face down. Prone, that's face down in medical language. And I'm on all my fours, my knees and my hands.
Are you in downward dog?
Sort of downward dog, yeah. And then I bring my knee across to the opposite chest.
Oh, yeah, I like that one. That's like, and then you kind of go in a plank.
Well, then I kind of lean onto the knee. And I feel my butt really stretch out. Because my weight is sort of this hand pulling. Mm-hmm. So I have more force that way. So that, you know, that's kind of a different way of doing it. But I'm just putting this in because you can also do this with a tennis ball.
Yep.
If you don't have a foam roller. But it's good to squeeze muscles. And it's good to stretch muscles.
Yes.
Then this is just a printout. There's a nice picture to show the muscles and the attachments to study it. Mm-hmm. Because now we're sort of done these back here. Well, we've done this one, but these are also sort of there. And then we've done that layers on top of them. Mm-hmm. Okay? Now we're going to go to the muscles in the front. Or let me ask you this. If you want to raise your thigh up, which muscles would you do that with? Muscles in the back or